Bueno, quiero mencionar otra vez que este curso
I would like to mention again that this course is in collaboration with the IAI, Bajo, and you can select the language you want to listen in. You can choose the interpretation into English or to listen in Spanish. This week, we're going to focus on vector-borne diseases and zoonosis with Dr. Elizabet Estallo and Dr. María Soledad López. Next week, we're going to discuss data collecting and surveillance on health adaptation for climate change, and the following one, regional recommendations for climate change in public policy. If you have missed any of the previous sessions, you can see all the recordings in the course website, as well as any materials and publications shared with us by the speakers. I remind you that this is a 90-minute session. We're going to first have 60 minutes of content by Dr. Estallo, and then 30 minutes with Dr. Lopez, and then a short Q&A session. This session is recorded and will be posted on the website within 12 hours. And you can also see the course slides. This is the website that many of you are already familiar with. And now I'm going to introduce our colleague, Dr. Elizabet Estallo. I'm going to stop sharing the screen. Dr. Estallo currently works at CONICET, the National Scientific and Technical Research Council in Córdoba, Argentina. She does research in vector-borne diseases, vectors ecology, social and environmental determinants. Her current projects involve social and environmental determinants on vectors such as Phlebotomina, Triatomina, and Culicidae. She is a Nat Geo explorer studying hot islands, regulating ecosystem services and mosquitoes, focusing on public health issues. And also with us is Dr. María Soledad López, who graduated in biodiversity from the National University of Litoral in Argentina. She is currently studying an associate professor at the Center for the Study of Climate Variability and Change. She is research in the area of climate services applied to public health, particularly the study of vector-borne diseases, mainly linked to climate. In the past years, she has participated in scientific projects and publications about climate and environmental indicators of the presence of dengue and other diseases in central Argentina. Her research is aimed at providing information that can be applied in the development of public health policies. Thank you, and Dr. Estallo, I give you the floor. Good morning, everyone. It's a pleasure for me to be sharing this information with the health community. I'm going to start sharing the screen. Well, as I was saying, it's great to be working on this course about the climate change response for health in Latin America. And thank you especially to Anna for the opportunity to be discussing vector-borne diseases with you. Since my beginnings working in science, I was drawn to applied science, a science that involves the society and vulnerable groups. I liked a lot to be able to go through vulnerable areas, to talk to the community where these vector-borne diseases are a problem, and to be able to show them, for example, with mosquitoes and mosquito-borne diseases to show and to try to tell them how to prevent these diseases, which are very relevant, not just for human health, but for animal health as well. Also, it has been great for me to work on different government programs, for example, in the province of Córdoba, working with the Ministry of Health in all larvae monitoring campaigns throughout the years. According to the WHO, 3/4 of all emerging infectious diseases originate in animals, and they are classified as zoonoses because they are transmitted from animals to human beings. Zoonoses are a group of diseases that are transmitted to humans through direct contact with an infected animal through bodily fluids such as urine or saliva, or through the presence of an intermediary such as mosquitoes or other insects. These can also happen as well when meat that hasn't followed the sanitary corresponding health controls, or by eating fruit that hasn't been, fruit or vegetables that haven't been washed. This connection between domestic animals, wild animals, and human beings makes that these diseases from animals are more frequently transmitted. And so we have this arising concept of One Health that is some decades old, but is becoming more relevant because of COVID, this pandemic that we have been living with for a couple of years already. And this One Health concept takes into account the interactions between human health, animal health, and the ecosystem. And it emphasizes these interactions, the fact that the environment must be healthy, and it also has to be sustainable so that we can all interact in a healthy manner. And this One Health concept emphasizes these interactions. And in order to better understand and respond to vector-borne and zoonotic diseases, we need multidisciplinary and coordinated collaboration, because each of these three spheres are not isolated. If our environment is diseased or altered, then the health of animals and human beings will be altered. That is why in 2008, the World Health Organization, together with some other agencies such as the Food and Agriculture Organization, with cooperation from the World Bank, developed a strategy to reduce infectious diseases in the interface human-animal environments. In 2012, One Health launched a global network with the aim of improving health and well-being through preventing risks and the mitigation of the effects of the crisis that originate at the interface between humans, animals, and the environment, emphasizing the need for a sustainable environment. Vector-borne diseases are many, and many are relevant not just in Latin America and throughout the world, and they are recognized by the WHO. We know, for example, of malaria, dengue, yellow fever, Zika virus, onchocerciasis, leishmaniasis, Chagas disease, and these are produced in human beings by pathogens that are transmitted by vectors. A large number of these pathogens are viruses, but we also have some parasites, nematodes that cause diseases in humans. But most of these viruses that are known as arboviruses are spread precisely by mosquitoes. Most, 90% of these viruses are spread by mosquitoes. These organisms that are pathogenic to humans are maintained in zoonotic cycles. For example, the West Nile virus in birds, in the case of yellow fever, and in some cases, the human beings can be hosts, incidental hosts, not amplifying the virus. So humans do not develop a viral load that is enough so that when the mosquito bites that human being, it can spread the virus. Sometimes the host, like in the case of yellow fever, is in an urban cycle, and this generates cycles of urban outbreaks. When a healthy mosquito feeds from a human being that has the virus, the mosquito is diseased for life, and then it will spread the disease to every person they bite. And that is how the virus is amplified. As for malaria in Latin America, in 1973, Cuba obtained its certification, and then many other countries obtained that certification from the WHO. The malaria-free certification is obtained when a country can prove that for 3 years they haven't had an internal case. In El Salvador was the last one in Latin America to obtain this certification. Then previously Argentina in 2019 and Paraguay in 2018. Even though there's a sustained trend in reducing malaria from 2005 to 2014, in the last few years, there has been an increase in the total number of cases since 2015 in Venezuela because of illegal mining and different situations, and in some endemic areas in Brazil, Colombia, Guyana, Nicaragua, and Panama. And in some countries are progressing towards eliminating it, such as Costa Rica, the Dominican Republic, and Ecuador. As for lymphatic filariasis, that is caused by a nematode transmitted by a mosquito, we have 12.6 million people still at risk in Latin America, and 90% of those are in Haiti. The countries that have the endemic disease are Brazil, the Dominican Republic, Guyana, and Haiti. In Brazil, what happens is in a metropolitan area in Recife, in Pernambuco, it's still present, but there's an elimination plan being implemented by distributing anti-parasitic agents, and it's really close to being eliminated. Onchocerciasis is caused by a nematode that is spread by black flies, and since 1995, it's not present in the Americas, and there have been no blindness cases. And the WHO has already verified the elimination in Colombia in 2013, in Ecuador in 2014, in Mexico in 2015, and then in Guatemala. Onchocercosis is currently a challenge in the Americas, especially in the border area between Brazil and Venezuela in the Amazon, where the Yanomamis live. This is the main challenge. Cutting the transmission is the main challenge. Leishmaniasis is caused by the parasite, and the vector is a sandfly. There are almost almost 68,000 new cases of visceral leishmaniasis in 13 countries in the Americas, and more than 39,700 cases of cutaneous and mucous in 2020. In Argentina, is considered a zoonotic emerging disease. As for Chagas, we know that it's a disease caused that influenced by socioeconomic and environmental determinants. The bug that transmits it, we have found that there more than 6 million people are infected in Latin America and the Caribbean, and around 70 million people are at risk. It's endemic in 21 countries in the Americas, so this is also a big challenge. In the Americas, we have 30,000 new cases every year and 14,000 deaths on average, and 8,000 newborns who are infected. Dengue, Zika, and chikungunya is a subset of diseases caused by viruses. The main vector for these viruses is the Aedes aegypti mosquito. Around 500 million people in the Americas are currently at risk of contracting dengue. According to the distribution of these diseases in 2021, we see that there has been an increase in the incidence of dengue in the Americas. As for Zika virus, it came to the Americas in 2014, probably through, and it entered through Brazil probably during the World Cup in June, July 2014. And by the end of that year, the virus had spread throughout Brazil. In 2016, there was an interesting outbreak because it reached 28 countries. Chikungunya was first detected in the French part of the Caribbean island of Saint Martin with lab confirmed cases, and then it spread throughout the Americas with a significant outbreak between 2014 and 2016. From 2017 onwards, it is found mainly in Brazil.
Over 90% of the arbovirus communicated by tick mosquitoes or phlebotoms. Okay, so here are the answers. Mosquitoes. Over 90% are transmitted by mosquitoes, and across the Americas, the most significant are the Aedes aegypti mosquitoes, which carry dengue, Zika, and chikungunya. Let's go on. There are several factors that will promote vector-borne diseases. There are multiple factors: socio-demographic factors, climate, environmental. For example, the impact of human activity like urban development, building infrastructure, an increase in the population in urban areas at a very fast pace in a disorganized manner leading to a water scarcity of drinking water, forcing people to store water in open cap containers, which will promote the growth of new vectors, inappropriate waste collection, and there are many containers used, disposable containers that will result in breeding grounds for further mosquitoes. There are more larvae habitat available for mosquitoes like Aedes aegyptis in Cordoba city, for example, where I live in the center of Argentina. Aedes aegypti and Culis isifasiato share artificial breeding grounds, and they breed, lay eggs in natural environments in addition to coexisting with the Aedes aegypti mosquito. Some of the activities that will promote the loss of biodiversity are factors that favor vector-borne diseases and zoonotic diseases, for example, deforestation, building dams. There is a loss of habitat, and this will affect biodiversity, and the time-space pattern favor more larvae habitat. Deforestation, for example, in the case of deforestation, there are several studies in Brazil where it's been observed that a 10% increase in deforestation will lead to a 3.3 increase in the incidence of malaria. When deforestation takes place, it seems that we are creating the ideal habitat for mosquitoes to reproduce. In the Peruvian Amazon, for example, we have found more larvae of Aedes darlingi mosquito, and this is very common to see next to the roads and the paths of water where the water remains stagnant. International traveling will lead to a constant exchange of people around the world, and these, of course, will favor zoonotic vector-borne diseases. Climate and weather, differences in temperature, rainfall, humidity levels, these will also affect and favor vector-borne diseases. Temperature, for example, it will affect stings, reproduction, survival of these vectors, but also of the pathogens that they transmit. Rainfall patterns have a very strong impact, which is more evident, for example, when it comes to mosquitoes that have water stages in their development. Although humidity will also affect mosquitoes, it is more directly linked to vector-borne diseases without aquatic state like flies, sandflies, tick. These will affect the interannual and weather seasons in the incidence of the different diseases. Climate change, a direct result of human activity, enables and promotes vector-borne diseases as it generates changes in environmental processes, leading to an increase in temperature, changes in rainfall patterns, which at the same time will lead to favorable environmental environments for vectors and pathogens in the warm areas around the world, as it happens in Cordoba. Second Zoom question. Changes in environmental processes as a result of climate change lead to changes in vector population, increases in temperature, and changes in rainfall patterns, or does it produce more pathogens?
Bien. Bueno.
Okay.
Justamente los cambios en los procesos ambientales como
Changes in environmental processes as a result of climate change will lead to increases in temperature and changes in the rainfall patterns, which will in turn lead to alterations in vector population. And of course, as you can see on the screen, these were the two most popular answers. And of course, as a result of this, if we have more vectors around, more availability of and alterations in the populations, these will lead to more pathogens as well. But let me just stress that changes in environmental processes lead to an increase in temperature and changes in rainfall patterns. Environment and changes will have a strong impact on the distribution and abundance of species, not just vector species, but also the pathogens that these species will transmit and carry to mankind and causing outbreaks and even pandemics. According to the latest IPCC report, we can observe potential changes in the prevalence of vector-borne diseases due to climate change. The IPCC has reported some concrete examples for Latin America showing the effect of climate variables, mainly rainfall and temperature. So it's been reported for Central America, for example, in Honduras, that rainfall and relative humidity have a positive correlation with the severe dengue cases. In Costa Rica, temperatures and rainfall have a correlation with rabies outbreaks and mortality in a period from 1985 to 2016. It's a large period in Costa Rica. We've also observed that leishmania incidents showed 3-year cycles associated to changes in temperature, and in Panama, rainfall was associated with an increase in malaria cases across indigenous and highly vulnerable populations living under the line of poverty, and islands that were affected by the increase of sea level. In South America, the increase of the populations transmitted by vectors could be associated to changes in rainfall and minimum temperatures during El Nino events. El Nino events were associated with dengue and leptospirosis, and relative humidity, rainfall, and temperature have been observed to have an impact on the incidence of dengue in Colombia, and the increases in minimum temperature levels were associated with malaria spread and transmission. So changes in temperature, rainfall patterns are showing a direct link or having an impact on zoonotic and vector-borne diseases. So there are several studies in Argentina that show the relevance of climate variabilities and environmental variabilities in the generation of predictive time and space models, particular minimum temperature to determine the Aedes aegypti vector in the warm areas of my country. My country is Argentina. Vector-borne diseases like the vectors that carry them change their time and space patterns over the years. This is very clear in the Aedes aegypti distribution. At the beginning of the 20th century, by 1930, it was spread across Latin America. Around 1947, with the help of PAHO, a campaign was launched to eradicate the Aedes aegypti vector in the Americas, and it was successful. We were able to eradicate it in almost every country, but after the campaign, for different circumstances, countries began infecting one another, and probably because there was a lack of control of this vector in the Americas and a lack of campaigns. And over the years, this has led to a recolonization. In 1986, Aedes aegypti was reintroduced into Argentina, and by 1997, we are already showing the first cases to the north of Argentina, to the north of the country, in Paraguay, in Bolivia. And in 1998, there was a significant outbreak in the north of Argentina. And in 2009, the outbreak of dengue reaches the central area of our country, a more temperate areas. Aedes aegypti in Argentina, up until the year 2000, it would reach 35 degrees south, but this distribution is continuously expanding. This map is a 2008 map showing a distribution of Aedes aegypti and Aedes arupitu here in the northeast in the province of Misiones. But by 2010, we've seen records of the vector in different areas with a higher latitude, 38 degrees south in the city of Neuquén. There are records, but that doesn't mean that the populations have established here, but the vector activity records do show that the distribution is constantly expanding. This is the result not only of climate, but the movement of people, particularly a passive movement of people and communication routes between the different provinces and the different countries. By 2020, we have a very recent study showing the activity of Aedes aegypti in the south of Argentina, in San Antonio, to the south of the province of Rio Negro, and showing a well-established population in Tandil to the south of Buenos Aires, and researchers conducted different sampling activities, and they found Aedes aegypti's eggs across the city over a quite interesting period of time. So we could say that the Aedes aegypti's population is established in this area. And what is interesting is Tandil in Buenos Aires shows the coldest average temperature between 14 and 17 degrees. So that shows how adaptable the vector is as well. The dengue outbreak reached the center of the country, the temperate area, in 2009. And after the 2009 outbreak, we can see, well, these data in particular are for the city of Cordoba. There was an increase in dengue prevalence or incidence from 2009 to 2016, which were the data used for that particular publication. It is essential, therefore, that we understand how climate affects directly or indirectly the vector population, and of course, it will affect the pathogens that they carry. Studying climate variability through changes in the environment and how they affect pathogens and the prevalence of these potential diseases, we need to establish the potential connections between climate change and the impact on health. Therefore, it is essential that we learn about the environment, the seasonal dynamic, meteorological data monitoring, vector surveillance. Ili, do you mind speaking up a bit? It is also important for surveillance programs. I mean, this is important for surveillance programs that we learn about our environment, the seasonal dynamic, meteorological data monitoring, and surveillance of the vector and human behavior. After the 2009 outbreak in Córdoba, a research center, the research center I work with, and the epidemiological area of the Ministry of Public Health of the province of Córdoba cooperated in a study from 2009 to 2018, monitoring larvae. With a research perspective, we make our contribution in designing a study to analyze the distribution across the city of Córdoba. We visited 600 houses a month, and we did this every year in the period of November to May. We carried out this study from 2009 to 2018. So larvae monitoring allowed us to learn the dynamic of the vector, and together with the larvae monitoring, we placed traps to learn how the vector behaves through the position of female samples. We did so from 2009 to 2013. This made it possible to analyze the time-space dynamic of the vector in relation with the dengue incidence in the city. What we observed is there is an increase in the number of households with young stages of these vectors through the period under study, and we observed in 2009 5.7 percentage of households that were positive, and this number already increased to 15.4% in the 2016 period. This really show the assumption that larvae quantity is associated to the warm temperatures of these months and peaking in the summer period between February and March. And in March, we've seen an entry of these imported cases, followed by another peak in the spread of local dengue in April.
And this research took us almost a decade. And even though we couldn't find a positive association between between the transmission of autochthonous cases was not connected to climate variables, but this allowed us to start an exploration. And then other studies that we are conducting in the province of Santa Fe, which is also in the central temperate area in Argentina, that has a really high incidence of dengue, especially in the last few decades. Santa Fe, like Córdoba, are big cities. They have significant population with a great traffic of people as well. So what we need to what stands out about Santa Fe is that it is also a connection hub with neighboring countries. So it's a route to connect to other countries. So this also makes it so the number of imported cases is significant. To predict, to prevent, these will enable us to generate tools for decision makers to conduct a comprehensive management of the problems and optimizing resources when taking control measures. In 2013, but we had started before, we are working in the north of Argentina. We have the case of San Ramon in Santa, where we could identify the areas with the highest activity of the vector. This is in the province of Salta, really close to the border with Bolivia, and the activity of vectors is present throughout the year. But these are very important tools to have, because they would help decision makers to prioritize measures in some areas. Then in Córdoba, we are creating risk maps using environmental data with satellite sensors, taking into account environmental and social and demographic variables to create a map of the different areas and stages of the vectors to create this susceptibility map. And these are the areas where the vector finds optimal conditions to develop. And if the virus enters the city, practically since 2009, it's entering the city every year. And so once it enters the city, those are the areas that are the highest risk. Other predictive tools, as I was saying, are temporal models using weather and environmental information that will enable us to predict peak activity throughout the years. This environmental information obtained from remote satellite sensors enables us to identify environmental factors that condition or determine the presence, distribution, and abundance of vectors, and therefore the diseases caused by the pathogens that they transmit. And from that information, we have different classifications, and we can calculate indices with vegetation, and also have information such as surface temperature to feed into our predictive models to know not just in the space, but also in time, what is the evolution of vectors. The fluctuation, both in space and time, of vectors is conditioned by multiple factors that also interact among themselves. So we not only need to take into account the weather and the environment, but also demographic and socioeconomic information, because they are all factors that interact and mean that one area we have more presence of that vector or a highest activity, or during which time periods we have peak abundance of the vector, so that we can take preventive action before and not during an epidemic. And for this, we need close cooperation and collaboration with policy makers and decision makers that work in the area of health to guarantee that this new knowledge that is generated by researchers can be put into practice. And that is why we have these urban hot islands with Nat Geo. We have been working together with the municipality of Córdoba, the epidemiology and environment area, and we are collaborating, both researchers and decision and policymakers. And we hope that the results from this project will be available for decision makers, and that they can be useful to have a more sustainable city, a healthier environment, and to have a better health for the population as well. Because this project, we're not just studying hot islands in the city, but also the biodiversity of mosquitoes in the city of Córdoba, and the connection between the different species of mosquitoes, especially those of healthcare relevance, like Aedes aegypti, and the connection between them and the vegetation as well, to create cool islands in the city and the hot islands that are generated. That is precisely because in this global climate crisis that we are, it's important to work for scientists and decision makers to work together to understand how the climate affects the dynamics of transmission as well as the distribution of vector populations and the transmission of diseases caused by the transmission of pathogens to human beings. So we need to provide the information for decision makers so that they can take that and apply that. That is why the articulation and coordinated work in multidisciplinary groups is so important. Thank you very much for being here today, listening to a bit of what we do. Thank you very much, Dr. Estallo. We have a lot of great questions. I thank the audience for their participation. First, we're going to listen to Dr. López, and then we will have some time to answer some questions. Dr. López, I give you the floor. Well, good morning, everyone. It's great to be here today with you and to share also this class with Elizabet. I'm going to today be discussing with you a disease that is spread throughout the Americas and that is connected to climate, and that is leptospirosis. So we're going to discuss the disease, the infectious agent, the way in which it's transmitted to humans, and also showing the connection between hydro weather factors and leptospirosis outbreaks, also highlighting what climate change could cause or is causing in Central America and South America in connection with this disease, and also the multidisciplinary work in these kinds of diseases. It's a zoonotic and highly infectious disease that has global implications in health, both for morbidity and mortality of people, and also other living beings such as cattle and pets. There are around 10.3 million cases and 58,900 deaths every year, but it's also significantly underdiagnosed because the symptoms overlap with symptoms of other diseases that are under the umbrella of fevers. So it's very important to have a differential diagnosis and also to assess the exposure that the patient could have had before infection. Also, the majority of the cases can develop a severe manifestation of the disease between 7 and 10 days after infection. The patient can show the severe form of the disease. So this means mortality is quite high, around 10%, according to the WHO. It's also a disease that is sporadic and epidemical. And that is why it's not always top of mind when we are diagnosing. There are risk groups that have to do with occupations or recreational activities, especially in some areas that are connected to rural areas or agriculture and cattle raising, such as veterinarians, workers in rice and sugarcane plantations, also people who clean sewers and get in contact with rainwater that could be contaminated. And there are also publications that show outbreaks in some recreational activities, such as marathons, athletes who have had cases and there have been outbreaks, and also in fishery and hunting. There are also publications that show that there have been outbreaks in children from going into swimming pools that were contaminated. So because of these activities are especially conducted by men and young men, so the median rate is highest in men and young men. It's associated to extreme and climate catastrophes. In this case, I'm showing pictures of a flood in the city of Santa Fe in Argentina in 2003. This was a very significant flooding that covered a large part of the city, including the historical part of the city, because of the highest level of the river that overflowed into the city. And this caused an outbreak of leptospirosis of around 140 cases. And we have the records from the journalistic publications from those times, because we still didn't have public national epidemiological bulletins at that point in history. And then the leptospira is the bacteria that causes leptospirosis. It's of the genus Leptospira, and it has 13 species that are pathogenic, so that they transmit the disease. There are about 260 serovarieties. They can be different, or they can vary in space and time. They can be different in geographical areas, but also in one geographical areas, we can have one predominant variety at one time, and then at another point in time, we have a different one. That is why it's very important to do the surveillance of this pathogen to know which variety is present at a certain point in time at a certain place. The main reservoir of these bacteria are rodents, some that are autochthonous or some that could be considered exotic, such as moose and ratus, the genus, but also some that are indigenous to South America, such as Captoremus, Acodonus, and Oligorsimus. And they can shed, when they are infected, they can shed the leptospiras throughout their lives. Other possible reservoirs can be domestic animals, such as dogs and cats, and cattle, such as cows and other farm animals. In this case, they do suffer the disease, especially the reproductive effects. So they have miscarriages and fetal death. This is very significant for taking into account the economic factor, especially in countries in a country such as ours that has a great dependence on agriculture and cattle raising, in the province of Buenos Aires especially, where there is an important presence of leptospirosis. So vaccination of those animals is a very significant form of prevention to reduce those losses, and also indirect prevention from infection to human beings. And finally, human beings end up being an accidental host of leptospirosis. They contract the infection through contact with the urine of infected animals, infected reservoir animals, and it can also contract it through contact with contaminated water, water that is contaminated with urine from infected animals, but also eating vegetables or fruit that have been contaminated. There are publications from Brazil reporting outbreaks caused by people who have eaten contaminated food. In humans, just as in reservoirs, the leptospira deposit in renal tubes. so where they reproduce and can affect other organs and are shed through urine. Here we're going to have a first little break to ask the first question, and that is whether infected rodent can shed leptospiras throughout their life. Is this true or false?
Bueno, perfecto. Sí, exactamente.
Well, great. Exactly. Yes, rodents that are infected can shed leptospiras throughout their life. And if we consider that they had a median life of between 1 and 2 years, one individual can infect the entire environment where they live throughout their lifetime. This map shows the distribution of leptospirosis outbreaks throughout the world based on a literary review that looked at the period between 1970 and 2012 and found 318 outbreaks in the world that are distributed in the intertropical areas. And most of the outbreaks were in Latin America and the Caribbean, 82%. And then about 70% in Latin America, then less than 30% in Southeast Asia. Around 27 outbreaks take place a year, and these outbreaks had a mean 82 cases a year on average, and about 82 cases per outbreak on average. But some countries had more cases. The maximum recorded was 253, and those were in countries close to the tropical areas. The reasons why these things happen, the conditions for an outbreak to occur, the main reasons are floods. And why this happens is that when there is a flood, the available habitat diminishes, and the available habitat, because it is reduced, they need to find other places, and so they get closer to the places where people live.
And that will increase the likelihood of infection. The picture shows different floods in countries across the Americas. But what we need to stress is that floods are not only the result of climate factors, but there are other conditions like political, social factors, as Elizabeth mentioned. The political factors have to do how risks are managed, particularly in smaller municipalities, to address these frequent, ever so more frequent climate events, how we plan land use planning in a given city. And it is also associated to social factors like irregular settlements, how people settle in flood-prone areas, for example, the flooding area in rivers our rivers, the rivers that we will find in the central eastern area of Argentina, like the Paraná River, are rivers that have a flood plain where most of the time the river will not overflow this area, but there are certain seasons where when the river will grow and go over these floodplains. If people settle in the areas that are part of the river's floodplain, they will be more exposed, they will become more vulnerable to floods and associated diseases. There are many papers across the world and in the Americas that have observed leptospirosis outbreaks after floods. Another reason why there could be a link between rodents and leptospirosis is an increase in the number of rodents. Why and what could cause this increase in the number of rodents? The study that you can see on screen, they carried out a literature review in the period from 1552 to 2002, a period of 450 years. Bamboo blooms right here in the black dots, and rainfall patterns or significant rain events that you can see as white circles on that map. The authors show how these two factors favor the food production or the availability of food for rodents, and this at the same time leads to more reproduction of the species and therefore an increase in number. What the authors say that is that El Nino event, it is also a determinant of rainfall, as we have mentioned before. El Nino event could lead to more frequent and more abundant rainfall patterns in some areas of South America, for example, the south of South America, and therefore El Nino event would also have an impact in the increase in the number of rat populations and in promoting reservoirs for leptospirosis. This translates into, well, in the cities, into a higher risk. This paper from Brazil, Sao Paulo, the graphs show how if there is an increase in rainfall, there is an increase in the relative risk of being infected with leptospirosis. Now, the other graph shows that as rainfall increases, the likelihood of being admitted to hospital due to leptospirosis also increases. Based on all of this information and background around the world and in the Americas, my research team and I wanted to study 2 years ago what happened with this time and space analysis of leptospirosis in the provinces of Santa Fe and Entre Rios. These two provinces share climate and environmental characteristics, and we wanted to study the spatio-temporal analysis of leptospirosis incidence. As you can see in the map, around the province, there are several courses of water, the Uruguay River, Paraná River, Salado River, and there are a number of secondary water courses, and we wanted to study the incidence not only at province level, but at city level, the city of Paraná, Santa Fe, and Rosario, which are the larger cities in terms of the number of population. Some of the results, as you can see on screen, show but we study the incidence from the 2009 to 2018 for the provinces of Entre Ríos and Santa Fe. That graph shows not only the incidence, but also the presence of El Nino events. It is the cycle, the Enos cycle, which alternates El Nino, La Nina, and neutral periods, where we are not going to see either El Nino or La Nina effects. And we can see how those peaks for the highest incidence of leptospirosis in the provinces match or coincide with an El Nino event. So 2009 and 2010, where there was a significant outbreak, and 2015 and 2016 as well. This other graph is at a lower scale, at municipality level for the city of Santa Fe, the same period under study, and we added new variables. In addition to the Enos cycle, the bars show the number of leptospirosis cases. The black line shows the hydrometric level, and the dotted lines shows the rainfall patterns. So as we can see, whenever there was an outbreak or an increase in the number of leptospirosis cases, was the same moment where several variables came into play. Increase in rainfall, El Nino event, and hydrometric levels that were close or over the flood line. So as we can see, several variables came together and which led to an outbreak. The same in the 2015-2016 period. Now this is for the city of Rosario, something similar for 2009, 2010, but now 2015-2016, although we did see all the conditions that would have made it likely for an outbreak, but the cases or the number of cases was lower. It is also true that these were more widespread or more scattered over time because El Nino phenomena also lasted longer. We believe these results are due to the prevention strategies, prevention with people living around the river, people living in the island, people also addressing the water emergency that we were facing at the time. We did not, unfortunately, consider prevention as one of our study variables, but that's why I want to stress how important it is that we have access to healthcare statistics, that we need to know how many people were admitted, where do these people live, when were they educated, when prevention measures were put in place. So all of this information is necessary. We need to consider them in these type of studies, as we need to analyze whether these strategies were useful in order to reducing this number of cases. Something similar for the city of Paraná. Here's the outbreak and all of the variables coming together. And 2015, 2016, as we can say, the cases, uh, there was a smaller number of cases. This is a descriptive study, and we designed a mathematical model based on an epidemiological model, which is the SEER model. It is very well known, very much used in the literature, and we adapted it from the 2007 YAPTA model. This involves a population of, well, human beings, vectors, and between human being population and the vector population, there is what we call the transmission rate, the leptospirosis transmission rate. Human population includes vulnerable and infected people and people who have recovered after an infection. The vector population includes susceptible vectors and infected vectors. And the transmission rate, which is a novel aspect of what we have included in the SEER model, hydroclimatic variables. For example, the distribution of rainfall across the region under study, and we also incorporated the flooded areas as determinants for the infection rate. So these were the flooded areas, and we considered three particular moments of the Paraná River: hydrometric level at a minimum, at an average, and a maximum. And through satellite images, we calculated the surface of the flooded area. We incorporated it to the mathematical model as a function, just as we also incorporated rainfall as a function. That picture shows the quality of the model, the mathematical model for Santa Fe, Rosario, and Paraná cities. The dots show the observed data, and the curve shows the results of the model. The model observed relatively well, models the data, the observed data relatively well for the three cities where there was an outbreak. So we could say that on the one hand, that it is very important to systematically monitor the evolution of climate-related infectious diseases, and it is also to do dynamic modeling of infection diseases that are related to climate variables, as this could be considered what we think is a climate-related service for healthcare purposes, to, for example, prevent future outbreaks, but also to try to estimate the potential magnitude of such future outbreaks. Finally, I wanted to make a quick mention with regards to climate change. According to the sex assessment report of the IPCC for Central and South America, it is stated that most of the regions in the Americas, the ones that you can see in red, will likely be affected by a higher frequency and intensity of rainfall, more frequent, more severe, leading to greater floods. If we consider this, which is actually already happening, and it is also expected for the future, it is very likely, like due to the characteristics of leptospirosis, that this is the ideal ground for it to continue to happen, and they will probably become more severe and frequent. Now, it is not just the weather, as I said before, that will condition an outbreak. There are social, political, and health factors that could also help us moderate the magnitude of any potential outbreaks in the future. So my second question is, have there been leptospirosis outbreaks in the area where you live?
Bueno, acá podemos ver que, bueno, la leptospirosis, muchas gracias por la información, nos sirve
Thank
muchísimo.
you. This is very good information.
Podemos ver, bueno, la leptospirosis quizás no es una de las enfermedades más importantes en
Leptospirosis is one, might not be one of the most common diseases in the America, but it does have important characteristics that we need to consider. It is important that we should consider this as a possibility whenever we see a patient, whenever a patient is admitted, to try to make up for a more efficient diagnosis. Okay, so to wrap up, I want to mention some recommendations and conclusions. We can say that leptospirosis is one of the main problems in the connection between animal, environment, and human beings, and we can address it from the One Health perspective, which is, well, our main focus when developing this epidemiological model. We wanted to consider these three factors. The cities are growing, they are growing into natural and rural areas, which will lead to a greater contact between wildlife and people, and floods, which are more frequent as well, and there are many times more severe, are also destroying the natural habitat, leading to a greater contact with human population. Therefore, it is very important to better understand the relationship between the different varieties of pathogen leptospirus and how they interact, how these varieties interact with the environment, with the weather, and with the reservoir, leading to different effects in the human population.
Also to include climate and weather variables in surveillance systems for zoonotic diseases and vector-borne diseases. And this can help us improve early detection of outbreaks. This also, for this is also essential for health information to be accessible through public publications and with databases that contain information and that are publicly available. This will help us in the analysis, and it's also essential to work jointly and to have exchanges between the academia, the specialized researchers, and government systems of health, the environment, and weather. We also know that climate change is more and more rapid, so we need to create networks to work in an interdisciplinary manner to improve the way we approach these diseases. These are some references for this presentation, and thank you very much. And thank you as well for the organizers for inviting me. Thank you, Dr. Lopez. And now for the final minutes, we have a chance to answer some of the questions from the audience. We have some great questions. So now we're going to send most of those questions so that they can reply in writing and we can share that with you. First, for Dr. Estallo, you shared so many studies about vectors and virus. What changes or what response have you had from public administrations, and how has the interaction been in the interface science and policy in your group? Well, through the cooperation that we started in 2009 and until 2018 in the province of Córdoba, they have continued working with other organizations, not with us, but with other organizations in a multidisciplinary manner. So it's been positive. because I believe that decision makers need to take a multidisciplinary approach to understand and to approach different problems. As for the current project we are working on, we are in the development stage, and it has been really good, the interactions, because not only are decision makers interested in the results, but they are cooperating actively. They go out into the field with us, they provide the logistics for us, and that is very good that they get their hands dirty, so to speak, to work with us, because that is when they can really understand the problems before making a decision with the results available. Thank you, Dr. Estallo. Dr. Lopez, we had many comments in the chat about the under-recording of leptospirosis cases. So perhaps you can discuss a bit the challenges and how we can strengthen surveillance in order to understand the behavior and to build tools for early detection. Yes, it's really a big problem with this disease, because as I was saying, the symptoms are common among that one and other fever diseases. So they're not top of mind often as a possible disease. And this is a big complication, because once the diagnosis is established, if the diagnosis is late, the disease can evolve rapidly, can progress rapidly. So this should be taken into account as an option for diagnosis, first of all. And also, as we know, there are different ways of detecting the disease. The final detection and diagnosis is done with cultures, but there are faster methods. So the idea for quick diagnosis, and this would improve the disease progression for the patient, and we can catch it in time. So there are other methods in serum, but most of all, my recommendation would be to remember that this is possible and to take this into account when diagnosing, because it has such a fast progression. Then if we have a late diagnosis, the patient has less chances of recovering fully. We also know that there are areas where cases are possible and situations when we have floodings, when we have large levels of rainfall. It's not just with river floodings, but also flash floods caused by rainfall, something that is happening often recently. We have heavy rainfall in a short period of time, so a city is covered in water. So this can also cause cases of leptospirosis. So we need to pay more attention as a healthcare sector to those climate or weather situations that make cases of leptospirosis more likely. And thus we're going to be able to slowly reduce cases and to be able to see the actual dimension and impact of the disease. Thank you, Dr. Lopez. And Dr. Estallo, I wanted to ask you briefly about your experience working in an area where dengue is emerging, which is different from working in an area where dengue is endemic. What recommendations do you have for citizens, for the public sector, or for scientists to work in areas where it is emerging? Well, what's very interesting for us currently is to do citizen science, to involve the educational community, elementary schools, secondary schools, and through them to be able to reach families. With the research doing citizen science, we have involved schools in the city of Córdoba, and they have become involved in the project. And we not only can share our knowledge about the vectors, but they understand it and they bring that into their own homes. They recognize the places where the vectors breed, and the students themselves, the teenagers, also share that information with their parents and grandparents in a very direct manner, because sometimes we see that there are good public campaigns in the media, but through working directly with the community, we can reach these people and involving them in the research and raising awareness about the real dimension of the problem that we have in Córdoba. So I would recommend, yes, it is a lot of work because you need to ask for permission for the students to get involved in the research, but it's very interesting to see how the children understand this and make it their own. And so that it makes sharing knowledge and affects the decisions that they will make at their own homes. Thank you so much. Again, thank you, Dr. Lopez, Dr. Estallo. I'm seeing a lot of questions, a lot of comments congratulating you. We have heard some key messages about the relevance of strengthening integrated and comprehensive surveillance, the importance of involving citizens, and how to create public policy in situations where these diseases are growing with climate change and situations such as deforestation. Before we finish, a colleague is going to share information in the chat about a project right now underway about mosquitoes in Argentina, and we will see you on Thursday for our next session with other colleagues to share their experience on data, in sharing information, and on surveillance in health. Thank you and see you soon. Thank you everyone.